Good afternoon and welcome to Carf Auditorium here at UK Healthcare in Lexington. I'm sorry I can't be there in person with you today, but I think with social distancing, hopefully we all understand. But again, I want to thank you for including us as a part of the SOAR Summit. It's great for us to be a sponsor, and we've been able to see all the great things today that are happening and all the things coming together to make and drive Appalachia and all the things around it to the very best place to make a difference in the lives of all Kentuckians. And that's what I want to talk to you a little bit about today. I want to talk to you about leadership and resiliency in difficult times. And I will show you the first slide that you see here. I want to say we don't get this close to Kentucky during the pandemic, but I wanted to show you this is about our patients and our people. And to give you a little bit of a background on kind of who we are and what we want to do or how we want to make a difference. If you look at, UK Healthcare, we're about a 1,000-bed hospital that can grow to 1,300 patients during our pandemic with our emergency capacity. We're a unique academic medical center with a number of different research capabilities, more than 42,000 discharges a year. And again, on the academic side, we're growing very well. Again, more than doubling our NIH funding in our College of Medicine over the last 3 years. So we're a very proud place. And we are that place for Kentucky as well. As you look at us and look at the number of discharges, more than half, about 20,000 of our patients are transfers from other health systems across the country. And we want to be there for the state. We want to be that institution that can do it and make a difference. We're actually the #1 transfer center in the country, and that's because of being able to be that resource for Kentucky. But a lot of what we do is to work with our healthcare partners across the state to be able to create more capacity, to be able to create more expertise so that the patients can stay closer to home for their care. If you look again at across the different parts of the state, what you'll see is different areas in the state where we have different affiliates, whether that's cancer affiliates, heart affiliates, stroke affiliates, and also where we are adding additional, again, educational facilities in northern Kentucky and on the Bowling Green campus to increase the number of physicians in training, the physicians that are going to be available for the state of Kentucky. That is what we want to do. We want to be that institution that creates resources for or manages in a way that we can improve or enhance the health that we can deliver to Kentucky. So we're excited about that and excited to talk with you today about our continued role and our ability to respond in a crisis. If you look at this year, I've described the 2020 to our board as a roller coaster. And if we start early in the year, one of the things you see is that we were moving along well with a new strategic plan, a new electronic health record. We did have a little bit of a dip with a cyber attack moving forward, and then COVID came about. And you'll see that we received the first COVID case in the state. But then on down, what we started to see was that elective procedures were ceased, and that we not only had a COVID issue, but we had a financial issue that we had to recover from as we start to move back up, as we start to look forward. And as we think about responding to a crisis, as we think about the different components of that, one of the key things that I think is important early on is to be able to think about the preparedness. We had disaster plans. We had surge plans in place that we could bring together and understand how we were going to respond. And we put the patient at the center. How could we provide and work with people across the state to provide that very best care? And I think that preparedness, that centeredness on what you're trying to achieve is really important during a crisis. The second thing is that people need to understand and see transparent data because that explains to them why we're making the changes or the things that we have to do to try to improve or to make a difference. And I think that's a key. As we were trying to do, I think that was one of the strong early things we did because we were able to use some of our own analytics to say, what is the probability of what we're going to see and where we're going to go? The other thing is communication has to be constant. We're not through this. We're continuing to go. And I learned that last Friday. We send out 3 times a week, we send out a communication from me to all of our staff, all of our physicians, to kind of give them an idea of where we are and to give them tips on how to get through from a day to day, as well as reminders about importance. This one on last Friday went out several hours late because of some issues. And we got hundreds of calls because people were worried. What was happening? Was there something I didn't want to tell people? And it was just a little bit of a glitch and delay, but it shows the importance of people having that, again, that communication and that comfort, if you will, about knowing and having the information in front of them and knowing the direction that we're going, knowing what we're going to do or how we're going to respond. The other part, support and invest in your people and celebrate our heroes. If you go out in front, you'll see the big banner that says heroes work here. This is a long-term emergency. And that sounds odd, but that's kind of what it is. It is a situation where every day your staff are put in a situation where they're at risk. They're put in a situation where they could potentially put their families at risk. And so how do you, again, take care of the patients, but it's about your patients and your people. And again, recognizing them and supporting them and being out there is key. I think innovation, and you're going to see some of the things that we're doing here to innovate and to help people not only locally, to help our own people, but help people across the state. We have to work in a crisis. You have to work smarter and not harder. There is going to be, in things like this, there is going to be staffing issues. There's going to be difficulties because even with everything that we do, we will have people that go into the community and become ill. And so we have to think about how do we make our people more efficient? How do we support them in the work that they want to do? And lastly, persistence with the goal in mind. Never give up. We have to know because the hope was, when we started this, well, this will be a month or 2 months or 3 months. And now it's only been 7, but it still seems like that we've been in this mode for a long time. How do we support them? How do we give them the day-to-day information and support to keep them resilient despite the fact that this has not been as short-term as we might have hoped? I want to take you back a little bit. This was March 7th. When, again, and you can notice no mask and we're not socially distanced, we hadn't thought about it. We had our first case in Kentucky. And we were trying to, and again, my goal at that point was to reassure people, was to reiterate that we have capacity, we have the capability. And I want to reiterate that to everybody in the audience today. We are in a great place. We are learning every day about how to treat people better, how to reduce infections, how to do that. And a lot of it I will also put back out to the audience to say a lot of the ability to reduce the infections is to people in the audience. How can we mask? How can we hand wash? How can we socially distance? How can we, again, in situations where we're in a red county or a red state, try to reduce the probability that we're going to see that spread? That's an important part that I want to reiterate. But we were learning. And we continue to learn every day. And next week, you'll hear more about work that we're doing as others are doing on a number of different vaccines. And so that's a way that we get to the end, but we're not quite there yet. As we looked on early, some of the concerns we had early, we were doing a number of different modeling techniques to look at the probability of how many patients would come to us. And early on, this was one of the scary, looking with SG2 and looking at what had happened in Wuhan and in Italy, we were looking at UK healthcare and the probability or how many patients we may see at our peak. And we saw numbers like 1,200 you can see as maybe, and that could have been just at UK healthcare that had COVID, and more than 200 or 300 in the ICU. And that was, again, something that we talked to our staff about, talked to our physicians about, and talked about how we would respond. And one of the things we did in response to that is that if we had that as a potential, we needed to figure out how we would deal with that both in the throughput and at the peak of what we were able to do. And you can see this is Nutter Field, where our football team normally practices indoors, and we turned that into a 400-bed field hospital. Thank goodness we never had to use it. But the idea at the time was that preparedness. and the ability for us to help think about how the state would respond, how the region would respond. How would we be able to take care of these patients if we do see a peak? And I want to reiterate, even with the surge that we're seeing now, the smaller surge that we're seeing now, I want to reassure that we have the capacity in the state to be able to take care of patients both in our beds and in our ICUs and our hospitals. So I want to reassure along those lines. But what we had to do at that point was be prepared. The second thing is that we had to create this kind of communication both across our hospitals and across our region to understand what we could do or how we could work with each other to make things work. You can see this is the Regional Operations Center for Kentucky, or what we call the ROC. This was the ability to create a single number where if a smaller hospital or a hospital in our region had the difficulty, that they could call that single number and we would help them get their patients transferred to an appropriate level of care, because you can see we'd have the bed information and the bed numbers from multiple hospitals and the larger hospitals in the region. You know, again, we're getting ready to potentially reopen that again because we see and feel the need that we have across the state to be able to feel comfortable, to know that you have that place to send the patient when the need is great. And so that's a key thing, is we want to be that resource to help you get things done. The other thing that we were lucky, and I will say lucky, because we had built a new facility, what we call Pavilion A here at UK Hospital, and we had looked at from the standpoint when it was built, we built it with the capacity that every room could be an ICU room, every room could be a negative pressure or negative pressure room, and every room, if needed, could have 2 ICU patients driven by separate ventilators. And again, that's an unusual capacity, but it was built with the idea that we would be ready no matter what happened in times of disaster or in times, in this case, of a pandemic. And as you can look, where we go at each level is that we would potentially adjust and increase our capability to take care of COVID patients as those numbers increase. Now, that does mean that we move people from one area to another, and right now, we're here at level 2. We have about 48 patients in UK healthcare that are COVID positive. And I want to reiterate, that is a low level, but it is still, again, higher than we have been before. So we adjust and we manage and we do the things we need to do to be able to take care of that. Now, to deal with this from a resiliency and make people comfortable, one of the key things that we did back at the beginning is we set up plans for how we would deal with an enterprise preparedness. Because when COVID came in and we reduced our volumes, we had the opportunity to prepare. We had the opportunity to potentially set up people. If you can look on this if you can look on the far side over here, the redeployment phases, as we would go up, we would redeploy our employees and our healthcare workers to be able to do things that were important for us to take care of more COVID patients. But it's like back when I was in the military. I was primarily a cardiac anesthesiologist, but in emergency, I was a hospital commander running a mobility hospital. Those are the type of things you have to do and adapt in emergency situations, and we have set up the capability for each of these surge levels to be able to do that. People own it. They understand their part in that, and I think that's a key towards our ability to adapt, but also because they own it, they feel engaged. They feel a part of that, and that's what they can do to make a difference. And I think making a difference is one of the key aspects of resilience through difficult times. They can see what they're achieving, and we can go forward with that as we move forward. I just want to do a couple of things. Taking care of COVID patients is difficult. This is, again, what we call a PAPR, or a powered air purifier. And this is what, our staff go through each time that they would enter a room with a COVID patient and leave. Then they would have to, we call it donning and doffing, the equipment. And it takes a lot more people, and you can see why people would be concerned that they were putting themselves or others at risk. But I think it's a key that we've been able to learn and expand. Early on, we were completely worried about what we call PPE, or protective equipment. And now, again, we've been able to have greater numbers so that we can make sure that we keep our people protected. The other thing we had to do was adapt to new things that we've never done before. Drive-through testing. We weren't doing drive-through testing before. You can see here some of our staff doing drive-through testing. The other thing was telemedicine. We did some, but not much. And now in the last several months, we've done more than 100,000 visits. This is that innovation, this adaptation. And you'll see that in a minute with our EICU. The other thing you have to do, and I hit on this when I went through the list, communication. I really think sometimes that I'm communicating too much right up until the time, like I said last Friday, when I didn't send an email and suddenly we have hundreds of calls about what's wrong. People need that reassurance. They need to know direction. They need information and transparency to be able to get through this, because then they understand it. Even if you have to communicate bad news, even if you have to communicate in a direction about where this is going, it's important that they have that information and that you push that communication. The technology, this is EICU. Again, the timing was really good. This is a capability, and you can see an individual over there in what we call the cockpit, which they're at a distant location, but able to look into the room where the patient is, see have all the data about how the patient is doing coming to them, as well as a camera to be able to, and microphone to be able to communicate with the patient. So it was great for our COVID patients because we could take care of them more easily without having staff go in and out of the room as much. It also allowed a mechanism for our family to see and talk with our COVID patients more easily. And I know that we've talked about that. That has been one of the most difficult things for both our family and our staff, is how do we protect the family? How do we protect the patient? But in a situation, it's more difficult because they're not used to having that kind of separation. The other thing that we've moved forward on, that we were working on, this is, again, our electronic health record that we're moving forward with, that we'll be starting in June. It's important to continue to move forward, to do those things that you can do to create more resources for your staff. And so that was an important part of our electronic health record. I'll take a little bit of the time I have, because I think this is an important slide as we look at it, this talk from the change map, but I will reiterate as a leader, and we think about the potential of where things can go versus where they actually go in these two different lines. And I think early on, there's the concern or their anticipation. And as a leader, you have to communicate. You have to give them information. You have to hold them on track. As it starts to go further and you're starting to let go, they realize things aren't what they used to be. And you have to listen and reassure. It's again, and then I think you move to the next step, which is the disorientation, and you have to direct. You have to start to move them and understand that we are going to see the light at the end of the tunnel, but we have to move forward. We have to have that recommitment that we all see about trying to make a difference in the lives of our patients and trying to make a difference or try to create a healthier Kentucky. And I reiterate to our staff all the time, it's not what comes at us, it's how we respond. And this quote that's always attributed to Darwin, I think is true for us. It's not the strongest of the species that survives, nor the most intelligent. It is the one that is the most adaptable to change. And we've had to do that. And I think as we move forward, we have to see the ability and see the light at the end of the tunnel. This is our new strategic vision as we move forward. One community committed to creating a healthier Kentucky. And whether that's right now in COVID or whether that's long-term and trying to make a difference overall, that is who we want to be. And that is that thing that they can hold on to about who they are and what they're accomplishing every day. So thank you very much. And I don't know if we have time for questions or where we're going to go, but appreciate you including us, and what is a great day.